So they planned this panel, and I'm just absolutely thrilled to bring this panel to you today. And we have Joshua Roll of Bristol Myers Squibb, who is going to be introducing the 4 horsewomen, these wonderful women who are going to do this.
All right. Thank you, Jody. And what a great panel to follow, too. I mean, I'm definitely a he for she. I'm excited to be here today introducing this panel on behalf of Bristol Myers Squibb. At Bristol Myers Squibb, we are driven by our mission to discover, develop, and deliver innovative medicines that help patients prevail over serious diseases. We work every day to transform patients' lives through science, and I'm proud to say that we have a long history of innovation in the cardiovascular space spanning over 100 years. By supporting WomenHeart in this summit, we are helping to ensure that women are not only informed about their heart health, but also empowered to advocate for themselves and others, and work to drive meaningful change. Together, we can make a significant impact on women's heart health, driving forward meaningful policies and research that will lead to better care and outcomes for all. We truly believe in a future where everyone has the opportunity to live a healthier life, men and women. Thank you to WomenHeart and HealthyWomen for hosting this summit and working in collaboration to move the needle forward for women across the nation. This last panel, truly a powerful one, representing some of the most influential and impactful voices in this space. Beth Battaglino, CEO of HealthyWomen, Celina Gorre, CEO of WomenHeart, Emily Holubowich, the National SVP of Federal Advocacy, the American Heart Association, and one of my mentors, and Katie Schubert, President and CEO of the Society for Women's Health Research. They'll be presenting on the landscape of health policy for women's heart health and how we can all work in a coalition to raise awareness and advocate for positive change. And with that, I'd like to welcome our moderator, John Clymer, the National Forum for Heart Disease and Stroke Prevention.
Thank you very much, Josh. Before we start, Beth, Celina, thank you very much for the opportunity. I'm intimidated by this powerhouse panel. Celina said, "Would you be willing to do this?" I said, "Oh my gosh, I cannot think of a higher honor to be here with the 4 of you." So really looking forward to this. We've heard this morning about, I think, 3 key things. 3 key deficits. One is the research deficit. Second is the clinical deficit. Third is the non-biomedical, or some would say social determinants. I would say vital conditions for health and well-being deficit. And Dr. Hashim said, I think, the most important sentence. There have been a lot of important sentences this morning, so this isn't to take anything away from any others. But I think he said the most important sentence so far today. I predict one of you will exceed that bar. And that sentence was, don't accept the status quo. Those deficits we heard from Dr. Burshuk add up to a massive deficit financially for society, and perhaps more importantly, losses to families, losses to communities, losses to society. So we can't accept the status quo. I'm so excited about what's to come tomorrow with, tell you what, we just saw a new study, I think it came out Friday or over the weekend, showing yet more evidence that physical activity is critical to both mental and physical health. So in that spirit, would the WomenHeart champions please stand again for just a moment? What you all are going to do tomorrow is so important. We cannot understate how important it is. And I love when I'm not in this room, but different meetings around the country, elsewhere, to talk about how powerful you all are in articulating the essential messages about women's health, about cardiovascular health in general, and doing it in ways that resonate with policymakers as well as with the public. So thank you so much for taking the fabulous training that you get from WomenHeart and putting it to use to create impact. What is it? Each of you leads an important organization, one that creates impact in its own right. So why work in coalitions? Let's start with Emily. American Heart Association. I mean, Emily, $1.1 billion a year organization. You have massive resources. Your office that you head here in Washington, D.C. for federal government relations is larger than, I think, the rest of our organizations, right? Combined.
It's still too
right?
small. It's still too small, by the way.
Still too small. So you have all that ammunition in hand. Why work in coalitions? What's the value there?
Well, great question, John. And first, I have to thank Celina for having me here today, and Josh for the great introduction. Bristol Myers Squibb stole Josh from my team, so I'm not bitter. But I'm pleased that they're a sponsor today. He's doing amazing work. And thank you to all of you. I think I have to first, before I talk about coalitions, just address the elephant in the room, and that is, if you're not paying attention right now, if you're not concerned, scared, confused, you're not paying attention. And I promise I will not be dark and ominous on this panel today, but it is why it is so critically important you're here right now in this moment. We cannot take anything for granted. Everything is on the table for destruction, and the only way to stop it, it is not a letter with our organization's logos on it. It's going to be the voices of everyday people in America like you who stand up and say, enough, this is not acceptable. So thank you for being here. I will now answer your question. I've been in DC for 25 years. Nothing happens in Washington, D.C. without the voices of voters like you and working together. There is no one single piece of legislation that ever passes because one person or one organization wanted it to be so, and that's why coalitions matter.
And that's coming from one of the people who I, for years, have said is one of the two most effective population health lobbyists in Washington, D.C. So your use of coalitions, I think, speaks to their value, their importance in driving policy change.
Coalitions are my jam. Yes.
Katie, the Society for Women's Health Research is, gosh, you've been around as an
35
organization.
years.
Yeah, how about
No, I
that?
need a pin
35
for
years.
that.
And you've accomplished so much, and yet there are these huge deficits we've been hearing about today. How you have, again, an important and a powerful voice in your organization's own right. So how do you use, I shouldn't say use, how do you collaborate with and
we
leverage
and amplify,
Yeah.
yeah. So, and first of all, I think this is all possible through coalition, and even the partnership between WomenHeart and Healthy Women is so important. And I've known Emily for a long time, 16, 17 years now. 16.
We know this because we met right before she went on maternity leave with our
my,
oldest
and,
son.
and my oldest son just turned 16, so it's 16 years.
I thought you were going to say you met in preschool.
No, oh, that's so nice. But we have been working together for a long time and know that, and so have seen many administration changes, as SWHR has seen. And the consistency with which you show up and your voice is heard, even if you think it's not being heard, is so critical. And so really thinking about, from a Society of Women's Health Research perspective, we're so broad. We look at anything that differently, disproportionately, or uniquely impacts women, of which heart disease is one thing. And so we really work to make sure that we are amplifying the voices of those who are in this space, and helping to carry that message ourselves, whether it's on Capitol Hill or with the administration, or leveraging our researchers and patients and patient advocates. And the one thing I will say, too, to Emily's point, my 41-year-old cousin had a stroke last year, and she lives in a rural area, and thank God her husband recognized what was happening and she was able to get help. But it is voices like yours and hers that are the ones that are going to make change. Because if you're not up here talking about it, it's not even in the heads of the policymakers, and so it's so critical to make sure that your voices are heard. So, thank you.
Thanks. Before I get to Beth and Celina, I want to say all of our organizations exist in an ecosystem that breeds frenemies, right? I mean, we need to work together. We can accomplish more together, and yet you can't save the world if you can't pay the rent. And we're often having to face situations where our organizations are competing with one another for finite funding. So it takes really mature leadership to bring these frenemies together and look beyond that dynamic and really accomplish things together. And so Beth, Celina, you really demonstrate that mature leadership by collaborating on today's summit. And every day you do. Beth, I'm going to jump over you for just a second. I promise I'll come back. Celina, WomenHeart, Susan Campbell, for as long as I can remember, was making so much positive noise on Capitol Hill and elsewhere to drive the conversations about women's heart health. WomenHeart has a great history of accomplishment, and you do a lot on your own, yet you collaborate. Why?
Gosh. First of all, it's more fun. Like, doing stuff alone sucks half the time, most of the time. So doing stuff together is just more enjoyable. And, for us doing this work, especially, let's say, in this time, is difficult when you do it alone, right? And, I know many of you in the room probably feel super daunted by what's happening out there in the world. And it's really easy as an individual to be like, I'm going to shut it out. I'm not going to watch the news. I've said this many times. I'm not going to watch the news. I'm just going to put my head down and do my thing. But then what you're giving up is a really important job that we all have in this room. We are stewards of a vision. And you are giving up your stewardship of a vision if you give up, right? You need to take care of yourself. You need to, sort out your mental health, as it relates to all the stresses that are out there, for sure. But the reason I do this, John, is because I'm going to have a bad day, and I'm going to say, this sucks. I don't want to do this anymore. But I want Beth to be like, hey, Celina, we got to do that. Oh, yeah. And I pop right back up, right? I pop right back up to my job as a steward. And that's what we're all here. We're here to support each other as stewards of a vision. And we've got to do that regardless of what happens in the White House. We've got to do that regardless of how much of an appetite there is for data and evidence. And I'm just going to say, because right now the appetite for data and evidence is not that high in politics, your voices become that much more important. And that's why we have to work together.
And Beth, we've heard allusions to and direct comments about the environment in which we're advocating now and endeavoring to improve women's health and heart health overall. When I think of Healthy Women, for years I've thought of your organization as a go-to source of fact-based information about women's health, various issues that affect women's health. Now we're facing an environment where there is all kinds of misinformation abounding. Some of it being driven by, let's be honest, being driven by disinformation. So it seems like it's more challenging today than it was last year, than it was 5 years ago, to get the facts through, to penetrate all the noise. How are you approaching that? How are you charting the course for the next 2 years, next 4 years at Healthy Women?
Well, timing is perfect, John. We just finished our strategic planning session, so it's all good. But we're focusing on what we've always done, and it's providing that medically credible information for women. And that's what Healthy Women has always done for more than 30 years. Our focus is women 35 to 64 years old. It's women in the middle that's so busy taking care of everybody else, she forgets to take care of herself. So we're making sure that she prioritizes her health. We're giving her the information she needs to take care of herself. I'm going to, expand a little bit, because when we talk about working together, this is how we all come together, right? Because I can amplify the great work that Celina and her team is doing. And when I look at all these beautiful faces and hear these amazing stories, we do not need to recreate the wheel. We can work with Celina and her group. I can work with Katie and her group. And Emily, it's lovely to meet you. And I know the American Heart Association, but we don't need to recreate the wheel. We can work together, and we're more powerful together, and we can help amplify the truth and then dismantle the misinformation.
Okay, I said earlier what I think was the most important 5-word sentence so far. I knew you'd exceed the bar, so the most important 4-word sentence: we're more powerful together.
100%.
Yeah. So, Beth, Healthy Women is a provider of great information, but you can't do it alone. So how do you work with others who amplify that factual information?
We work, everyone has their own audience. You know how we always say one size doesn't fit all, right? We all know that. Women especially, when they came out with that, we're like, that's never gonna work. We all look at the topic, and today we're gonna focus on women heart health, and we figure out how can we take this message and amplify it more to our audience. My audience is going to be a little bit different from Celina. My audience is a little bit different from Katie's, and my audience is different from Emily's, right? But we each have women. We have a big population of women who are our audience, and men. And how can we take that great information and get it out in the way that we know our audience wants to receive it? Not everyone wants a newsletter. Not everyone wants to go to a website. Some people like podcasts. Some people like webinars. Some people like coming to events like this. Everyone is different, and I think that's what we do best, and that's a part of our secret sauce.
Great. That resonates. So we've talked somewhat theoretically so far in this conversation. I'd like to start with Emily, work our way across the panel, and ask each of you to give an example of how you have worked in concert with allied organizations to accomplish more than you might have going it alone. And I'm hoping one or two of you may talk a little about some strange bedfellows.
Ooh, exciting. Reflecting on moments of joy, which I think is important in this moment, I will go back, which now seems forever ago, to December of 2024, and the passage of the Hearts Act, which we worked together on, and many of you, thank you, were so influential in that. And I think it is an example of strange bedfellows, even though it shouldn't be, in that Damar Hamlin's cardiac arrest on Monday Night Football in January 2nd, 2023, really brought to the table people who really hadn't been before, and that was the sports leagues. And so when you think about how to influence, it is everything. It's everything everywhere all at once. Different types of organizations speak to and resonate differently with different audiences and different policymakers. So having the NFL leading the Smart Heart Sports Coalition, of which our organizations are members, working together at the state level and the federal level with the American Heart Association, and really both top down, so these big nationally recognized brands, but also bottom up. We at the American Heart Association, we are powered by our people. I have seen advocates in action. I have seen those moments in those offices when the light bulb flips and you think, oh God, we gotta meet with this congressman, oh my God. And they connect instantly with their constituent and they change their mind. Yeah, I'll co-sponsor that bill. And so it's all of those things come together that are really magical and can make great things happen. And now we just have to get the money. So the fight's not over on the Hearts Act. We still have to get the funding, but that was a really exciting win and one that would not have happened without that coalition.
Emily, I want to bore in on a point you just made for a second. You talked about the impact of constituents' voices, of your members' voices. When they're talking with their representatives, are they delivering talking points or something from a script that you've provided verbatim, or do they translate it into their own language and perhaps different terms, but hey, they resonate?
I hope I'm not going to get in trouble, Celina. So, generally you'll have your talking points. There'll be some facts. We want to try to stick to the facts if we can. But I'm going to quote a colleague of mine, a mentor of mine, Lisa Simpson, who's the former CEO of Academy Health, and she always says, data makes you credible, but stories make you memorable. And it's the stories, hopefully, can that make the list of the top quotes? Okay. Do you really? Let's be honest. So I've been a lobbyist.
That said, that should be on a T-shirt.
Let's be on a T-shirt.
I agree.
Bumper sticker.
Yeah.
I've been a lobbyist for 20 years. My job is to spew facts. And I can go into any office and I can tell you all the data on all the things. Why we bring you to town. I can't tell your story. Charity, is Charity still here? She was here. Said earlier, your experience is your expertise. And it's in those moments, it's those stories that we see those connections happening and the data become real. So yes, make sure you get your talking points, make sure you get your asks in tomorrow, but make sure you're leading with your story, because that's what really matters. If they have questions about facts, they can call Celina afterwards.
Katie, a real-life success story.
Yeah, so a couple of them. I mean, one thing is we try to coalesce together, right, to make sure that we're information sharing, commiserating, or also just sharing, our own experiences in a variety of ways. So I think when you were talking about December 2024, I was like, oh, I don't know what she's going to say, because I was thinking of gathering at the White House to celebrate the Women's Health Research Initiative, which was the result of all of these folks coming together to make the case for why we have this women's health research gap, why we have these discrepancies. And so that to me was a huge win and something that sort of like bubbled up under the surface and has been bubbling up for many, many years and is the result of the work of everyone in this room, I'm looking at you, Martha, too, for really making sure that this elevated to a level that we hadn't seen before. And so, we had folks who we knew were going to be there, but also many others who maybe hadn't thought of themselves as women's health research advocates before. All of the disease state groups, if you will, who are not focused on women's health, came to the table and wanted to be engaged. And so it's really an important way to leverage what it is that we're all talking about from a variety of people. And just to reiterate to Emily's point, I found myself in a room in the fall with a couple of Republican female legislators. And I did used to work for a Republican female legislator. But that's not why I got in the room. We got in the room because we were talking about heart health. And they had personal experiences with it. And so they wanted to do something about it. And so even though you may not want to go talk about this, everybody has an experience with it. And I will also say, when you get up there and you're meeting with staff even, they need to hear this because they don't know it. I was 21, 22 when I started working on the Hill. I knew nothing. I don't know why they let me in there. But I remember the constituents that I met with, and I remembered their stories, and that helped me make the case for why this was important. So even if you don't traditionally think of folks as partners, I think there's hope there in thinking about areas where we can make some movement. This is sort of where I see it. I think heart health in particular, cardiovascular disease, is one area where we can get traction, bipartisanship, and movement in this year. So I'll throw that out to all of you for tomorrow to help all of us with up here to move forward. But yeah, you find these partners in a variety of areas, and you just have to keep an open mind too, because that's really how stuff is going to get done.
Thanks. Beth, what's an example of how you at Healthy Women have accomplished more, or perhaps done it faster, than by working with a coalition than you might have on your own?
Mike, I think anytime that you work with a coalition, you can move it faster. You generate more awareness. When we think about anything from a sign-on letter to even doing Hill Days, if we can work together. I mean, we work together, all of us work together on the Treat and Reduce Obesity Act. And it was just, now I call myself a lobbyist. I was following Katie. Oh, Millicent too. Where's Millicent? Yeah. Is she there? There she is. Hey, Millicent. Yeah. We all worked together on that act, and we're continuing to work on that. But what I loved is the diversity in our groups, and again, the audiences that we were reaching. And so when we all can work together, you can see how we can make things happen and change. And I couldn't agree more with Katie and Emily on the power, and Celina, all the great work you're doing with your the people in this room with sharing your story, because it really is that personal narrative that helps change the needle. And when you're meeting with congressional people and they hear where you're from, what state you're from, and your story, it does make a big impact. So I would say it's a lot of different things, but working together is much more powerful than trying to do it on our own.
Celina, real life example of higher impact.
I'm going to talk about one that's not on the panel, but the Alliance for Aging Research. They're an amazing organization that I think all of us at one point or another partnered with. And obviously they're not a specific disease area, but we're all here for better aging. We're all here for healthy aging. And every year they run a heart valve disease awareness day. And I think it is, us heart disease organizations be like, why are they doing it? But I don't ask that question because they do an outstanding job of it. So I think, you know, I want to go back to where we started about frenemies, because I was super naive when I got to Washington, D.C. in 2019. I was like, aren't we all going to hold hands? Like, aren't we all going to, like, just, there's plenty of work to be done. There's plenty of lives to be saved. Like, why would we, for 1 second, be fighting each other? There's a lot to be done here. And even if we all did everything we can do, there's still going to be more work to be done, right? But, you know, I learned over time that, you know, working and being successful in Washington, D.C. is, by definition, coalition work. If you come to D.C., you think you're going to do it by yourself, you're going to get spit out by the system so fast you don't know what hit you. So, you know, it's not a choice, John. It's like the way you do it, right? I mean, that is what you do when you advocate. When you're an advocacy organization, you have to do it in coalition. Even the American Heart Association's not going to go it alone, right? So if they're not going to go it alone, who the heck are we to go it alone? That'd be crazy. But like I said, I'll go back to the beginning. It's also more fun, and that is not to be underestimated. Joy is a really important part of this work, right? Emily said that word earlier. If that is not at the core of what you do, and you cannot exude that, then you're not going to bring people along. And you gotta bring people along, right? Like, that's what we're here to do, and we've got to make it translatable to the voter, right? To the average person in this country, and that's how we're going to do it, is by working together, learning from one another, improving it, making each other better. That's why I come to coalition too. I want to get better too.
Yeah. Yeah, we're not just here to improve, to marginally or incrementally improve women's health or cardiovascular health. I think we're all here, everybody in the room, to make the world better. And it is a whole lot more fun doing it together, as well as a lot more possible to do it together. Yeah. Emily, yeah, we've all made our comments about the resources that AHA has. We're grateful AHA has them, by the way. So even with that, I think we've had conversations where you've talked about how working in coalitions enables you to use, to deploy the finite resources you have more impactfully. Is that right?
Oh, 100%. I know I'm always, more is more. So I always want more resources so we can do more, but fully acknowledge that, as was said earlier, my federal advocacy team, my lobbyists, our department is larger than a lot of smaller nonprofits. That said, we know heart health combined. The heart health is all health, and health is in all policies. And so when I try to think about how do I deploy the 15 people I have to cover, last I counted, I think we have a list of 80-something priorities that we work on. Josh knows this, at the American Heart Association. 15 plus 80, that doesn't quite match. And so then how do we decide where we're going to lean in, and what are the priorities, but what are like the priorities? And for us, I think about what are the top tier priorities, the all-ins, when we're deploying our 300 advocates nationwide. I'm hiring consultants. I'm running digital ads. I'm doing radio ads and podcasts. What are those big things? It's where, you know, maybe others aren't already leading. Maybe it's where the bipartisan, nonpartisan voice of the AHA is going to really open doors and be the leverage that's needed. You know, this is all the art of determining the deployment of resources, but it's why, for the American Heart Association, I have a tracker. We are a member of more than 70 coalitions, big and small, that are working on all the things. because we simply cannot lead on everything. And as has been said, we cannot go it alone on anything either. So that's kind of hopefully demystifying a little bit about how and when we engage in different levels of effort. But it's all part of the calculus of where we think we can have the most impact and where our brand and our power is most needed in critical moments.
Katie, in promoting research, how do you leverage the power of your allied organizations?
I mean, I think each of these organizations and many others have access to research that we can then help promote, right? So we're going to constantly cite the work of other organizations and really make sure that those voices who are the strongest and most expertise, right, the biggest experts, are the ones that we are lifting up. My biggest thing is like, I don't care who gets the credit or takes the credit for something, like let's just get it done, right? So, you know, if we want to make sure we're getting something done, we want to make sure the right voices are in the room. And much like Emily, although I have 10 people total for all of my all of my activities, we do prioritize in that way. And so the number of coalitions is probably pretty close to the same number that you have, just because we have to belong to these groups so that we can stay on top of all of the different things that are coming down the pike, of which over the last few weeks, I feel like it's just been nonstop. So I think like just thinking about how we are lifting up those voices and researchers who are really doing the work and who are making those breakthrough discoveries that we can then use to make the case for whether it's funding for health research, whether it's for additional support on the policy side, whether it's to try to get more loan repayment programs for people in certain research areas, whatever that looks like, to really prove that these investments are critical. So we really work to make sure that we're citing additional resources. It's not just us. It can't possibly just be us. And really want to make sure it's very well-rounded as well. Yeah.
Thanks, Katie. So in a couple of minutes, I'm going to want to ask a magic wand question. If you could wave a magic wand and change or accomplish one thing in the next 2 years, what would it be? But before we get there,
Non-political answers only.
Yeah, I would like.
what fun would that be?
That's not going to get me in trouble.
What fun would that be? So, Beth and Celina, your organizations are, tell me if this is wrong, I look at your organizations as being in the information and message delivery business. Yeah, and you're exceptional in what you do there. A lot's changed in America. Some of it hasn't changed nearly as much as people inside the Beltway and the bubble that's here, and yeah, it really is a bubble. It probably hasn't changed that much. It's just that people here have awakened to what resonates with a lot of middle America and different parts of America. But it all boils down to taking a different approach to message delivery and so forth. So could each of you talk for just a minute or so each about changes that you're making in your messaging to enable your messages to resonate more broadly across the country in the next couple of years?
Yeah, I mean, we're doing that in a lot of different ways, but I think the main way and the most salient way was already talked about earlier today on the first panel, which is around talking about equity as rural health and thinking about access issues relative to rural health, right? That is, apple pie stuff, right? That is heartland stuff. That is, right, like farmers and, right, like people who are 3 hours away from the nearest cardiologist. And if WomenHeart can engage on those sort of in those conversations, we also help lots of other folks that have challenges in access, right? And so I think it's a really important question, obviously, because clearly our messages on some level haven't been resonating, right? We're kind of here in this place today in part because our messages haven't been resonating. So it calls us as organizations focused on health to rethink how we message. And for me, you know, I think it was Erin that talked about rural health, and that's really, I think that's where, at least for the next, you know, several years, we're going to have to think about our messaging.
I think so messaging is different for each audience, and because Healthy Women is a digital platform, we're able to see pretty quickly what's working and what is not. And so we're able to pivot fast and making sure that if we see that we're not getting an uptake, we can change. And sometimes it's just the words, that it's as simple as the words. But as we look from a policy access and safety issue, it's making sure that we're working with thought leaders that we feel can really deliver our message in a strong and succinct way. We have some really great healthcare professionals, physicians, nurses, nurse practitioners that do a great job at not only vetting our information, but being able to present, and so we use them when we can. And then it's, again, working with a lot of the people that you see on the stage and other great organizations, because we don't have to reinvent the wheel. We can use the great work that so many of our other organizations are doing and amplify their message and just be able to deliver it maybe in a different way to our audiences. So it's just working smart, but always working, not always, but trying to work together when we can, because it's much more powerful, and that's where we're going to see the needle move, is when we work together. More power and partnerships.
And from the National Forum, I heard a word in this that we're not using now. We're talking in terms of fair opportunities for everyone to attain health. And in some places, we're talking about fair opportunities for everyone to make healthy choices, reflecting that people do make choices. People have agency to make choices. And those of us in public health who have been imposing choices on people, I think have done a lot of harm to public health standing politically and in the public mind. We're also talking instead of social determinants of health, we're talking about vital conditions for health and well-being. And we're hearing, that's not because we came up with it, we didn't. People way smarter than we are did. But it's not because it's the new term of art, but because that's what we're hearing from policymakers resonates. And it doesn't hoist the red flag that social determinants does. Emily and Katie, we're in Washington. You're Hill rats, or you have been. So, let's have a little fun with this. What are a couple of messages that you won't be delivering, or at least you won't be delivering in the same way to the 119th Congress that you would have to the 118th?
Yeah, I mean, I can definitely start. I feel like we always have these conversations surrounding, do we say women's health or do we say the health of women? Which, literally, you all are probably like, what is the difference? It doesn't matter, right? It does matter, though, when you're engaging with certain audiences. So I think that's one thing we're still sort of trying to figure out, right, is what does resonate and with who, and what topics are the ones that we want to lead with, right? I firmly believe, as I said, that heart health and women's heart health is what we can lead with. That is what gets our foot in the door, because everybody understands that and they understand the implications. They may not understand the disparities for women versus men, but it's what's going to start that conversation. It's one of the few things I've seen bipartisanship on over the last decade. So there's sort of that, like, how are we couching what we think of as women's health and how are we describing it? The other thing I would say, and I heard a little bit about this earlier, is this idea of sex differences. So part of our job now is going to be to explain that sex differences research is not what people think it is, and describing why understanding differences between men and women is so important. I mean, we heard it on the last panel, and then leveraging our male allies. So thank you for doing that, because we need that. And so that's going to be a whole conversation, I think, surrounding why this research is needed. Why if you look at sex differences, it actually makes your research better and more effective and more efficient. And I think we're going to have to still continue to talk about why women are not little men, and that, again, no duh, men's and women's brains are different. You ask any person who's married if that's true, and they'll tell you that they knew that. But I think those are sort of the areas that we're looking at in terms of thinking about the messaging and how we approach particular offices. Sometimes our messaging that we've used in the past is going to work, but in other ways, we just need to think about how do we really get to where that other person is thinking. How can we meet them where they are and explain why this is important?
Emily, I'm going to amend the question for you, and then we'll open it up for a couple of questions from the floor. So if you have one already teed up, get your hand ready to raise. Emily, I've seen in the last few days a lot of social media messaging from our allies saying, oh gosh, these scientists their jobs are in jeopardy and they may have trouble paying their mortgages. And apparently that's part of the case for not messing with NIH and NSF. Does that message land in Middle America's kitchen table?
Short answer, no.
Okay, so how would you, I expected that, how would you deliver it so that it does?
Well, a couple things. Audience matters, first and foremost, with message, and the messenger matters. What we're seeing play out right now is what we knew would happen. The playbook exists. It is literally verbatim out of the playbook. It is happening now. And Americans, not all, not even a majority, a plurality of Americans wanted this. So, and I did an email the other day, and I said, not to get biblical, but forgive them, Father, they know not what they do. I'm Catholic. And I've been in budget battles my entire, because I think this is a function of a budget battle. What you're seeing play out right now, not to get too wonky, but this will be a constitutional question. What is the role of the executive vis-a-vis Congress? And are we in a monarchy or in an oligarchy, or are we a democracy? I mean, these are like the core questions that are on their way to the Supreme Court. In the meantime, there's going to be a lot of damage. And it will take time. I think everyone who lives inside the belt right now is feeling it very acutely. I was on a couch Friday night with friends who work for the federal government in tears. I'm going to lose my job. I don't know what to do. What we learned really quickly, so I was not to go too far back, but the last big budget battle I was in with Katie was in the 2010s around sequestration and budget cuts. I won't bore you. But what we learned very quickly, we knew we got to get stories. We would put out these call for stories, and people would not respond. What's the impact of these federal budget cuts on you? People fundamentally have zero idea about the ways in which taxpayer dollars in the federal government benefit their lives every single day, and they're going to feel it. We're feeling it first here in Washington, D.C. Nonprofits are closing. They're laying off staff. They can't draw down their federal grants. They're coming for the scientists next and your R01s. I don't want to scare you, but it's coming. This is happening. And it will take a while to ripple out to those folks in middle America, but it will happen. And when it does, Congress is your audience. If your lawmakers, DC office phone numbers and district office phone numbers are not yet on your speed dial, put them on there now. They need to hear from you. And here's the good news. We saw this play out on Tuesday. So if you weren't in the Beltway and you weren't paying attention, an executive order went out saying basically we're pausing all federal money. People went bananas. And then we saw an order, well, no, we didn't mean Medicaid, we didn't mean SNAP, it's these other things. And it spirals, and there's media coverage, and colleagues who were on the Hill that day said, I'm in these congressional offices, phones were ringing off the hook. There was a court challenge, but lo and behold, suddenly, by end of day, that had been walked back. Your voice matters, and I know we don't have much time, but I have to make a plea on this point. When I talked about all-in priorities for the American Heart Association, my top three are Medicaid, Medicaid, Medicaid. If I could wave a magic wand, I would protect Medicaid. And it's not even 2 years, it's like the next 6 months, because this is going to play out. We're talking about cutting funding for our nation's most in need in their health care to give tax breaks to millionaires and billionaires. You know, not a very populist message, not very popular. But if you're not thinking about Medicaid, you should. It's the top three employer coverage after employer-sponsored coverage, after Medicare. It's Medicaid. I'm going to get the numbers right. 72 million people in this country have Medicaid, which means I bet every single one of you in this room, you either treat someone on Medicaid, you know someone on Medicaid, you care for someone on Medicaid. More than half of Medicaid beneficiaries are women. And Medicaid covers more than 40% of the births in the United States, and depending on where you live, it's as high as 60%. If you are not caring about this program, which is top of the list for cuts, for offsets, you're missing the boat, because, yeah, we need all the things. We need discovery. We need data. We need women at the table. But if we don't have coverage to access those discoveries, we are falling short of women. So that is my plea. Like, please care about Medicaid over the next 6 months, maybe a little bit longer, and always. And we know the good news is we fought this fight before. We can win it. It was patient voices that saved the Affordable Care Act. We can do it again.
So here's coalition dynamics in real time. The American Heart Association is taking the lead on protecting Medicaid coverage. And those of us who are continuing our work on other priorities have an opportunity now to work in coalition with AHA and others to support what you're leading on to protect this coverage that is relied upon by so many millions of people. And women. Right? All right, yeah. Question from the audience. I'm going to let Calandra choose.
I saw a question back here. Dr. Kraft. Since time is short, I'm going to composite my question. I actually have two questions. For 26 years, we've been waiting for a track of money to give women's health research a true opportunity to grow and foster. How are we going to protect the $3.2 billion of money allocated by Joe Biden and his administration in this administration? And second thing I have to ask is, how do we grassroots mobilize women? Because I do think that the current Congress and the administration will respond to the people, because it's the people that put this current administration in power. And I was glad that you mentioned that, because I had suspected that that's what happened and why the pause was, which gives us a clue into the power we really have. We can't do this by, I feel like, the old methods. We have to innovate a new method. So how can I go back to my community and mobilize my women to write letters, to talk to the congressman, to be vocal? Do you have any suggestions on that?
I have a great answer for you, I hope. Yes. We cannot lose ground on what we have gained over the last few years in women's health research. We have never heard a president call for $12 billion in funding that they want Congress to allocate for women's health research. We've never had an executive order that says the word menopause, ever. We've never had an executive order on women's health research. So our goal and our priority at SWHR is to help to coalesce around this. And you're right, grassroots is where it's going to be changed. So we are taking a grassroots approach of hopefully coming soon for you all, an advocacy toolkit, which will give you everything you need to make that call, send that email, the language that you need to use, add your stories, et cetera. So that's coming soon, and I hope all the organizations will share that when we have that ready. On the grass top side, we are looking at high-level message carriers in a variety of spaces to take this publicly. Because if we're not, what do you say, Emily? If we're not at the table, we're on the menu.
We're on the menu.
I was a little rusty on that one. We need to squeeze this issue, right, from the top and the bottom, and that's how this is going to get done. And we are also finally sort of like, I guess I would call it behind the scenes, giving our champions everything that they need to make the case for why this is important in a bipartisan way. So we're working to create, if you will, like a congressional coalition on this, right? A bipartisan working group, so that when the people who are making the decisions get in that room, they know there are people on both sides who care about this, and that's what's going to make the difference. And I will also say, just very quickly, sorry, when I was working on the Hill, they tally every single call. I had a weekly staff meeting where it literally was like, how many people have called about this? How many letters do we have on this? They're looking at it. So you better believe that they want to hear from you. Well, whether they want to hear from you or not, you need to do it, right? So do it, get it in, follow up, serve as a resources when you're on the Hill tomorrow. Tell them, I'm going to be in touch. Send them little articles of things that you care about, all of that. It's really, really important. So hopefully we can help with that, and stay tuned for more.
Actually don't have any more time for questions, but you can speak with. Yeah, we have to do a closing.
We're here for lunch.
Yes.
If that helps.
They'll be here for lunch. Okay, thank you.
Are we done?
All right, well, this has really been enlightening. I think it's given all of us, your comments, the insights you've shared have given all of us information that we can put to use tomorrow and the next day and the next day to drive change, positive change, over the next 2 years, 4 years, and beyond. So thank you very much, Emily, Katie, Beth, Celina, for sharing your wisdom and your insights. And thanks for the great question.
Can I just say, I am blown away by what happened in this room today. All of you showing up, all of your energy, your questions. We had the most incredible speakers. I mean, these are friends, but these are folks that are going to change things, right? I am so inspired, in fact, that we're already going to schedule, and we're already planning for next year's WomenHeart Summit. So I look forward to seeing all of you there. It's going to be the same, what do they say, same bat channel? Same bat time, same bat channel. February 2nd, so it's always going to be the Monday, the first Monday of February. I also want to say a special thank you to Emily. I mean, AHA, I know, don't freak out, it's okay. We all in the heart space, obviously, we use AHA as a reference. It goes without saying, of course we do. But your openness and generosity for showing up in the way that you have, Emily. I want to just say thank you so much for representing AHA so well. I know I'm standing between you and lunch, but you guys have made a little girl's dreams come true. This has been an amazing day. And it's not over yet, right? We're going to have lunch now. A number of you will have advocacy training this afternoon. Our corporate advisory council partners, we're going to meet with you all. And then we get to celebrate. And teaser, if you're thinking about it coming tonight, but you're not sure, I'm gonna put myself out there and say, you have to see my tulle skirt tonight. So you've got to come. You've got to come. It's going to be amazing. Thank you once again. Thank you to Jody. Thank you to Calandra. Thank you to the team. They have just done an amazing job. Thank you again to our sponsors. Our sponsors have been incredible.